Hello everyone, hi, Dr. Steve here. Thank you so much for tuning in today's video. I got something really cool to show you, actually something that blew me away. Audience, you can just focus in on here. I'm gonna slide this picture over here. One of my colleagues is my Santa Barbara office, and I'm gonna introduce you to her in just a second. I'm gonna do this full screen. I'm gonna go back to here. So this is what blew me away. She shot me this text here, this photo, and this is how this young girl looked after. Maybe she has some braces, but she has all these spots on her teeth, and we're going to talk about what those are. And then she used this material that is like, what is that? And because she didn't have to remove any tooth structure, if you go to the final here, look at the difference there. I mean, it was a game changer for this girl. So I'm like, oh my gosh, Stephanie, we actually have to do this. We got to share what this material is, what this works, because we see a lot of patients who have these spots on their teeth. And so again, I want to thank Stephanie, Dr. Yong. Is that correct?
Yes,
Did I say?
that's correct,
Okay, yeah. I mean, I've known her she's been with me for a couple of years. So, so Stephanie, thank you so much for coming in today. She's been working in our Santa Barbara office, but before we get into how she did this procedure, which I thought was fantastic, let's get to know you a little bit.
Of course.
So that the Santa Barbara staff and a lot of my patients and I appreciate you. She's actually in my Santa Barbara office, so she's been seeing a lot of my patients down there, and I've heard nothing but unbelievable things, and I have all the confidence and faith in her to have her work on any one of my family members. So thank you.
Thank you.
Absolutely.
That means a lot.
So I was checking out her bio again, and last time I checked that was 2 years ago, so I forgot. And when she came in, I'm like, did you really go to this? So I wanted her to tell us a little about herself. I noticed that she went to a university. I don't know much about this university, Bryn Mawr. Is that correct?
That's correct, yeah. Okay. I went to Bryn Mawr College. It's a women's college. It's located in Philadelphia, and it's a liberal arts college. So actually, I was an anthropology major.
Oh, okay.
Nothing related to the medicine or dentistry at all. But I took all the prerequisites and kind of focused on getting into dentistry.
Awesome.
But I think having an anthropology major was all encompassing. You kind of learn about all the aspects of life really, and that incorporates really well with dentistry too.
Yeah, that is awesome. And so I'm just curious because I grew up in a dental family. My dad was a dentist, I'm a dentist, my brother's a dentist, 3 sisters side dentists, so I was kind of brainwashed. So what drew you to dentistry?
That's a good question.
I mean, she had a gorgeous smile.
Oh, thank you.
I mean, so
ortho.
Ortho, I should say, yeah, ortho, it'd be beautiful.
That's a great question. So dentistry, I have always wanted to do something in the medical healthcare, related fields, just because I love serving people, helping people. I love also art. And so I found out that dentistry is a lot of that encompassing together, right? Yeah. So you get that artistic aspect, you get to serve people, you get to help people out. And I love being able to have people, smile back. That's awesome. Where they were, yeah.
That is awesome. I love the same thing as the art and science, and it's really great because what you did here is complete art. I mean, it's like literally redesigning a kid's smile without actually removing tooth structure, which I think is fantastic. Okay, real quick though, I also noticed on your bio, which is interesting, it says here, your bio says patient-centered, prevention-focused. What does that mean?
Well,
I mean, I kind of know what it means, but
well, for any dentistry, right? I don't like to get in there and say, hey, let's do all these things because for whatever reason you see the disease going on. Right. If we can prevent the disease from the beginning, which means great hygiene, using things like Icon or even Curodont to prevent fillings, fake crowns, root canals, things like that, then I think that's what we should be able to do first for our patients, and that's really prevention, right?
Love that.
And that's all focused on hygiene and home care too. So if we can do those things before we get into bigger things, bigger procedures, then that would be ideal.
That's why the patients love you. That's awesome. And I probably cut you off because I'm just still curious. So why dentistry? Did somebody influence you to go into dentistry, or is just the art and science type of it?
Well, so I've tried to look into what I wanted to do for my career. Yeah. So I shadowed a bunch of doctors, dentists, thought about going into marketing.
Oh, really? So, well, you can do it all in dentistry.
Exactly.
You can be your own, you market yourself. In fact, that's what we're doing right now. So hopefully everyone will just fall in love with you, which I know they will, and reach out to one of our offices and say, I want to see Stephanie. Actually, we call it Dr. Yong. So
okay.
Okay, so the last thing I want to ask you about your bio, which I think is really cool, because she has a life too. She says, I don't know if she's any good, but she says she golfs.
Yes,
I do. I don't, so that's awesome. And you run still? Okay. and you do yoga, which is key.
Yes.
Okay, so fantastic. And so do you feel like that kind of keeps you centered, staying active?
Yeah, absolutely.
When do you find time? Before work or after work?
After work.
Yeah, me too.
After work.
So yeah, no, it kind of gets you, you
Yeah.
go home and kind of do those things. So awesome. All right, so we're going to get into what she did on this young girl here. Tell me about this patient and what made you guys decide this is the way you wanted to go with this young girl.
Yeah, so when I first met her originally, she came in, she had some other restorative work that we needed to do, so we got that all taken care of before we kind of delved into this. The biggest thing for her was that she was really concerned about the white spot lesions, right? Yeah. And she had these ever since she was a kid.
Okay.
And she's very much client facing with her job, and so she wanted something that kind of allowed her to smile and speak and have that confidence.
She has this she's very self-conscious, I would imagine, about that. So
yeah, absolutely. And so we kind of reviewed all the avenues of treatment that were available for her, and she likes the shape of her teeth.
Yeah, they're gorgeous.
And she likes how they're natural looking. And so we kind of came up with the option of Icon, and we kind of reviewed, what that kind of entailed. And so we gave it a shot, and she ended up really liking the results and was really happy with the outcome.
So it looked like, if you go back to this photo here, it looks like she had, she has a few teeth here. So did you do just the two front teeth? Or?
We started off with the front two just to see how they responded. And then after seeing the two front teeth and how they, had a good outcome, we actually decided to do her entire smile line.
Awesome. I mean, I think what you did is absolutely amazing. It's a game changer because, see, I've been doing this for 30 years, okay? And in dentistry, when we saw a case like this back in the 90s, early 2000s, we would actually just kind of buff out some of these spots, add some composite or a whole composite layer of veneer in there. And it looks good, but I mean, that is very natural. I'm all about preserving tooth structure. I agree with you. She's got a killer looking smile. She's got beautiful teeth. And anything that God can give you, my goodness, keep it, okay?
Oh, yeah.
So I think what you did there is amazing. Okay, so let's talk about white spots. So why do you think she got, I know, but why do you think she got these white spots?
Well, she did have fluorosis. So she lived in a different city before. And
what's fluorosis, more or less? I mean,
when you have an overconsumption of fluoride, right? So that depends on your city and the water and whatnot. And so sometimes when you have an over-ingestion of fluoride, that can happen.
Which is not as common anymore because most of the fluoride is out of the water in most of these cities. Yeah, it's very well regulated. And again, back in the 90s, a lot of the kids would be on fluoride pills that the pediatric dentist would give them, especially if they were more prone to decay. And there's a lot more fluoride in the water. And I'm going to do a whole video on fluoride one of these days because I'm a huge proponent of fluoride, but too much of it actually can create problems like this. And of course, it's not really great for your health. But topical fluoride and things of that nature, we'll get into that later. But this is what could happen. Did she have braces?
She did not.
Oh, wow. So that's interesting. I would have sworn she would have had braces, only because that could happen too. If you have one of your teenagers that are in braces right now, and as you guys know, I've raised 3 kids, teenagers. My office manager's right here. Trust me, she knows. But they're not the greatest brushers. They say they are, but they get the brackets in there. They're eating their food, and they don't brush after lunch, and so they get stuff clogged in there, and that can cause what do you call it? It can cause these white spots here, these lesions, because it dries out the teeth. It really sucks the minerals out of it, and it creates this areas of the same thing where it gets white and yellow. And that's another area where we can buff that out. We've had cases like that too. So pretty amazing what you did there. So walk us through how this works. Is it pretty easy? Does she need to be numb?
No, she does not have to be numb. It's pretty straightforward.
That's amazing.
No anesthetic, maybe some sensitivity. It depends from patient to patient because we are applying edge and whatnot to the tooth. So you kind of start off, you want to make sure you have a clean slate for the teeth, right? So rubber dam, and then, just make sure that the teeth are nice and clean with the pumice. And then afterwards you can, sand them if you can, just because the whole process is you want to get into the tooth structure.
Right. So you mean is it like a polishing disc you use?
Yeah, polishing disc is good.
Okay.
And so, you want to make sure that's all cleaned up, and then you're going to go in with the edge. You can kind of think of the white spot lesion as like a bubble, essentially, right? And so you're trying to get into that bubble and kind of get access to that white spot lesion. And so you want to go in with the edge. It's about 2 minutes. You're going to massage that into the tooth. And so the patient's really comfortable during this entire time. We have suction going, they're on a bite block, and so they're just relaxed.
Yeah.
And so then after that, we just rinse that off, and then we check with an alcohol,
Right.
essentially, to see if there's any haloing, if we got access to that white spot lesion. And so then after that, if you don't have access, you go in again with the etch. It may take a couple of sessions, anywhere from 4, if the lesion's not too deep.
And when you say a couple sessions, do you do the sessions on the same day, or do they come back?
All in the same session,
gotcha.
all on the
Awesome.
same day. Yeah.
So you're able to get those results at the same.
Yes, all on the same
She
day.
must have been so stoked.
It's a pretty amazing thing. So yeah, you're able to do that etch until you're able to get access to that white spot lesion.
Okay.
Check with the alcohol. And then if you have a transilluminator, you can check on the lingual side and kind of see if there's any halo aspect to it. And then after that, you're able to go in with the actual resin for the icon resin and kind of buff that in for about 3 minutes. And then you light cure from the lingual, make sure that you get that all polymerized. And then one more minute of that resin, and then you're good to go. You can just polish afterwards and get the final result.
Love that. I love what she did. And she communicates so well. Oh my gosh. I mean, the patients must just adore you. Again, this is Dr. Yong, Stephanie Yong. She's in my Santa Barbara office at Johnson Family Dental. If you have any information, or you have any questions about this type of procedure, or you just want to have a second opinion with the dentist, whatever it might be, just reach out to one of our offices. You go to johnsonfamilydental.com. And I'm telling you, if this was my daughter here, this is exactly what I would do. I would be as conservative as I possibly can. I would not invest money in putting veneers on. In fact, I would like to ask you, I mean, this is not that expensive.
Yeah.
It's about $200 to $250 a tooth, perhaps. I think this costs about $500.
Yeah.
But if you were to do like a composite veneer, where it's like we'd actually remove some of that tooth structure and then do an overlay of composite, which would also look nice, you're looking at about $700 to $1,000 a tooth. And then of course the veneer is closer to $1,500 a tooth. So this is, and again, this is her natural tooth. She's not going to break it. She can chew whatever she wants.
Exactly.
I mean, which is amazing.
Yeah.
So again, thank you so much.
Oh,
You're
of
amazing. This is Dr. Stephanie Yong. Sorry.
Yes.
And again, this is Dr. Steve. As many of you know, I've been doing this for over 30 years. I have 8 offices with an amazing team, and it's just fantastic to have you here. And I'm telling you, this is exactly what I would do if this was my kid. I would do this icon, which is infiltration concept, and I would go ahead and I'd have that taken care of. So again, many thanks so much for tuning in. And if you have any questions, please feel free to reach out. Much appreciated. Thanks, guys. Bye-bye.